Welcome to our Human and Planetary Health, the second event of our Spotlight series. So I'm Allison Phillips. I'm the Managing Director for our Human and Planetary Health Initiative, which is a multidisciplinary collaboration between the Woods Institute for the Environment at the Stanford Doerr School of Sustainability and the Center for Innovation and Global Health at the School of Medicine. So I'm so excited to introduce you to Desiree, LaBeaud, and Anna Stewart-Ibarra, who, Anna, we're so grateful that you're here. Anna spent how many hours on a plane to be here? A lot. I think 30, something like that, from Uruguay. And gave an incredible keynote yesterday at the Global Health Research Convening. Did anyone hear that? Yeah. Was anyone moved by that? And you're back for more? Yes, me too. So Desiree and Anna are both world-renowned climate and health researchers, and their science is amazing, but to me, the one thing that really stands out is the fact that they are deeply committed to value-driven work with really authentic intentionality around partnership and equity. So they care deeply about what they work on, but I think they care maybe even more about how they work, yeah? And they're so aligned that you might witness like a Human and Planetary Health Love Fest today. I don't know.
That's what they all signed up for.
I know. And when I talked to them yesterday about this event, they said one of their hopes and dreams was that you would leave this hour feeling transformed about the way that you might approach your research partnerships. So yeah, buckle your seatbelts. So Desiree and Anna recently edited a book, which will be coming out later this year, entitled Transforming Global Health Partnerships, Critical Reflections and Visions of Equity at the Research Practice Interface. We have some of the art from that book that's displayed over there. And the book will be published this April and will be available free for anyone who wants it. And rather than writing my own introduction, I actually decided to borrow a section from the book's preface, which they wrote, where they are introducing themselves as editors.
Lost authors over there.
Okay, lost authors. Never a good thing. So this is their introduction that they wrote about themselves. And it gives me the chills, honestly. We are self-identified women leaders in science and beyond. As scientists, we have investigated arboviral epidemiology and links to climate, environment, and social structural forces with public health partners in different countries. We have worked at universities, nonprofit organizations, and intergovernmental organizations where we have weaved community of practice across cultures and disciplines. We are descendants of European colonizers of the Americas, indigenous peoples of the Andes, and enslaved people from Western and Central Africa. We are women, mothers, friends, and colleagues. Collectively, we are raising 5 children, 1 cat, 1 dog, 3 chickens, and 2 gardens. Anything to add to that list since you wrote it?
Well, yeah. Oh, yeah. There's always things to add, right?
So Desiree LaBeaud is here at Stanford as a leader in human and planetary health. She's a professor of pediatrics and infectious diseases, a senior fellow at the Woods Institute for the Environment, and a professor of epidemiology and population health. And Dr. Anna Stewart-Ibarra is the executive director at the Inter-American Institute for Global Change Research. And she's also an expert on climate and health in Latin America and the Caribbean, and has a really impressive career history as well. So in today's event, Desiree and Anna will be in conversation for about 40 minutes. And then we'll turn to you all and the folks on Zoom today for questions for about the last 15 to 20 minutes. And then we'll have a reception just out there starting at 5 o'clock. So thank you everyone for being here, and over to you.
Yeah, thank you so much. So hi everyone, we are so happy that you're here with us, and we thank you for sharing this hour with us. And we're also so grateful for the people online. I don't know how many there are or where they come from, but we're very happy that you're here with us. So we have some ideas of where we'd like to take this discussion. We want to recognize that every single one of you in the audience, we welcome you to participate and drive us to whatever you want to talk about. We're going to probably mix it up a little bit and not just have questions at the end, but we'll probably try to involve you through our discussions. And please feel absolutely willing and able to participate with us. We're going to spend a little time talking about human planetary health. This is a human planetary health event, and we're at sort of this like very important nexus here. We're actually building a center for human planetary health here at Stanford, and so I will talk to you guys, and we will talk to you about that. And then we're here also to talk about this beautiful book that was such a deeply transformative process for the two of us, and we'll discuss that. But to get started, before we do any of that, I wanted to actually just take a moment and read part of the preface that we wrote for the book that I think a lot of our authors haven't even heard or read, but I want to do it. And anyone, I know there are a few of you here in the audience that actually are authors, we're authors, book authors. Can you raise your hand so people know you? Yeah, okay, so we have Josefina, we have Sonia, and we have Amy. And then there are others online, and maybe others that will be coming. So I'm just gonna read this and then we'll get started. Okay. So we hope this book can contribute to the rich discussion by colleagues worldwide about the need to radically transform global health partnerships, research systems, and funding structures. We also hope that this book contributes towards a new vision of the future, and that the authors of this book can inspire others to think critically, be courageous agents of change, and work for the health of people and the planet. Ultimately, the transformation of global health partnerships will require a transformation of consciousness through deep introspection and personal contemplation. This is what we have asked of the authors of this book. We have asked them to bring their whole selves, uniting hearts and minds. This is unconventional, even scorned or ridiculed in academic circles as insufficiently technical. The authors of this book are courageous in their willingness to be vulnerable and share their stories. The authors of this book humble us, as this is an act of great service and a tremendous opportunity to teach and learn from the human experience, and we thank them sincerely. So for those of you here in person and for those of you online, we just wanted to start with some really deep gratitude to you because it was a magical process, and we're really happy about what we're putting forth into the world, and it's because of you and your efforts and your courageousness.
Over 90 authors from 26 countries who contributed to this book.
Yeah.
Which began about 4 years ago, the journey.
Yeah.
So
yeah,
it's a really incredible community of people who have come together and brought their wisdom to share.
Yes. Yeah. Yeah. So we're humbled to sit here and be, but we invite the authors in particular to speak up today. And then finally, this book is dedicated to the next 7 generations of humanity. May your world be more loving, peaceful, and healthy than today. May it be so. Yeah. So we'll begin there. Okay. Dr. Anna. So tell us a little bit about you, about your life journey, about your experiences, your work, your roots, like what has brought you here today and what brought you to this place where you were able to contribute so deeply to this beautiful book and all that you're doing in the world.
Thank you for the question, Desiree, and it's just so wonderful to sit with everybody, to meet you, and those are friends and colleagues who are online. So I currently live in Uruguay, the southernmost capital of this hemisphere in Montevideo. I moved there 4 years ago when I began working with my current organization, Inter-American Institute for Global Change Research, the IAI. And we're an intergovernmental organization serving 19 countries across the Americas, working with governments and the scientific community to bring science on global change to improve decision-making in governments. And what brought me there before that was my own passion, but also experience and training in the area of ecology, global change, science, and climate and health. So prior to working in this intergovernmental space, I was an academic scientist and working on global health issues and partnerships, working with local communities and public sector partners to do research on dengue fever and the whole transmission system, working with communities to develop new interventions, mosquito control techniques, geographical modeling, kind of a whole suite of science approaches to looking at this emerging health issue in Latin America. I'm just kind of working chronologically backwards in my mind. And so, but what before that, sort of what inspired the work, I think, was my gut sense that I wanted to bring my training and my passion for environmental science and being in the field and working with communities and ecology, but now bring that to bear on issues related to human well-being and health being an obvious point in case. And I always had a passion for being in nature and in the field and outside and with communities, probably because of my parents being field biologists also. And so even as a kid, spent a lot of time in the field with them and learning about aquatic ecology, which later served me well as I was sorting mosquitoes late at night and rearing mosquitoes in the lab. And I'm still working backwards chronologically. My mother being from Ecuador, my father being from the US, I grew up with this sort of bridging of cultures, going back and forth. And that just marked me as a person, I think, sort of this deep awareness and commitment to some of the injustices too that we see not only in Latin America, but certainly here in the US, and how also, the history we talked this morning about our family trajectories and how, my mother's experience as a woman of color scientist in the US and the struggles that she faced, how that shaped me and inspires me today. So I'll stop there. But it's really amazing to be with you here.
Yeah. And another author just came in, Krish Sita over there. We thank you
Excuse my
deeply,
ladies.
Krish. No
Thank
problem.
you, Krish.
We thanked you. We thanked
did?
you.
Yes.
We did. We'll thank you
Nothing.
again
I wasn't
later. Don't
even
worry.
here. My God, excuse me. It's always late for something. I'll be late for my funeral.
So it's obvious to me we're here and talking. This is a human planetary health event, right? The world is in crisis, so many crises, but one of our most important is, what's happening with our planet right now, the climate crisis. There's so many crises overlapping in that, and so many injustices. And so why don't we start a little bit by talking about how you think, so this book that we all wrote together is about really, so there are 3 sections of the book, I'll just say, maybe this is a good moment to say this. There's a foundations part, which includes what we believe to be really the foundations of truly transformative global health partnerships. And we started with decolonization. This is the chapter that Krish actually wrote. And there's, women, gender issues in there. There's communication, there's team science, Sonia, or that, transdisciplinary approaches, systems science, the fact that you have to think in systems to solve complex challenges in the world. And so what we're facing right now, and we'll get to those other parts later, but in human planetary health is a massive crisis, probably the crisis of our time, right? So can you talk to us a little bit about, I guess, some of the tenets that came out in our book and just some of the work in our book and how our book work relates to just human planetary health in general? Yeah, health systems.
Well, planetary health and human planetary health, it's an academic field, it's a movement, you come at it from different ways, but at the end, it's about understanding that we are one planet. Like we're on one planet together. So the health of every single being affects the health of every other being. And we have to understand, and not understand intellectually, but understand in a much deeper way, this interconnectedness to be able to, I think, really evolve as humanity, to move forward, to identify solutions, to think about the future that we want to have. And so planetary health is one framework to do that, to say, look, we're all in this together. And the health of one child in Nepal is as equally important as one child anywhere else in the world, or an animal anywhere in the world. And so this requires us to break down pretty much everything we thought we knew, especially from Western frameworks, to break down our separate, individualistic, competitive mindsets, and to do a complete reset. And this takes us also then to a lot of the decolonial work and think about how do we go sort of this is the inner work, right? How do we go inside and reprogram ourselves? And through that process of changing our consciousness, transform the systems that we're in, be it the universities, our communities, our families. But first it happens inside. So there is a process of awareness, and awakening is another way to use it, to like recognize the issue and then recognize that there's another way of being, and that we can feel a deep sense of connection. Or we can also mourn the loss of connection, and we can feel that pain. And I think many of our, Indigenous scholars and friends, and Nicole Redvers and her co-author wrote a beautiful chapter in the book talking about this, and how the crisis that we're living is a relational crisis. And it's about the broken relationships and our complete disconnection from land, water, air, and each other. And until we can reckon with that and transform that, everything else will be, no, it's not gonna work. Like it will just be kind of band-aids and small fixes. Yeah, so no small task, but actually the process of writing this book, I think, is one grain of sand in this job that we have,
Yeah. And I'll just add to that exactly what you're saying, like our climate crisis, and a lot of it, I believe it to be so also, it is a crisis of relation, right? It is a crisis of, it's a reciprocal crisis, right? And so this entire book and this work was about partnerships and how you create relationship, right? And I think that it has a place in moving us forward and moving towards a better vision. So also here at Stanford, this is a crucial time. It's a crucial time for the planet, but it's also a crucial time for us here who are engaged in human planetary health work at Stanford, because there is a center that is going to be built. And Allison is one of the leaders of that center. And so I want to ask you about all of what we've gone through and all of that we've learned from working with so many people across the world and their stories and their learnings. What advice, what lessons would you like to share with us who are here, who are trying to build a new center for human planetary health at this university? What should we pay attention to? You have a list of tenets for us? You have a list of guideposts to make sure we're doing it right? Sybil, where are you? Because we really, many of us, I think all of us, I don't want to speak for, but we really do want to get it, right. We want to do something different, something real that's going to have an impact on our world. So what would you say to that?
I would say that we should think about a process, and I'm thinking about the process that we used in our book. As a community, come together and think about what are the principles that will guide the work. What are the historical injustices that need to be named and put on the table? Our very first tenet here: acknowledge the origins of global health and apply decolonial, gender, and intersectional frameworks to purposefully redress historical injustices and disrupt the status quo. So that's our point of departure. And then what are the tools and skills you need to do that as a community? And then if we look at the next section of the book, it's like a critical reckoning of where we are today. The second part of the book is around the case studies. And the case studies were meant to say, where are we today in the field of global health? We could say, where are we today as a community here at Stanford? What's been done, what hasn't been done, what works, what doesn't work, without judging, right? In a way that's just like, let's be honest and say what's happened, and creating safe spaces to do that.
But then I would even say, even going past that, and also not just even what's happened at Stanford, but what's happened at other human planetary health centers across this country, across the place, what's been working, what hasn't, and talk to others. Yeah.
Listening, reaching out, hearing from the communities, be it the academic communities, policy or governance communities, whoever you're going to engage with and influence and be influenced by, like, do a deep listening exercise to ensure also that you're on the right track. But then the last piece is really important, like as a community, coming together to really purposefully weave that future vision in a way that is creative and unbounded and aims to disrupt the status quo, to not just continue to do the same, business as usual. Like,
because the systems aren't working.
It's a tremendous opportunity to do something new. So like, take that and do it. but people have to be supported in doing it. And often I think, especially junior faculty, students, postdocs, who may have the most innovative ideas are those who have the least power in the academic system to bring these ideas forward. So how do you support, especially people who have less power in this process, to really bring these ideas to bear? Because often those who are sort of, again, old guard, there may be resistance to change, and you have to create systems that can support and accept transformation in a healthy way. It doesn't just happen. Sometimes you have to create intentional structures for people to be able to make change.
Absolutely.
And leadership matters, because the leaders will set the tone.
So I think we should take a pause here. And there's a lot of people in this room, and a lot of you are maybe hearing about maybe the Center for Human and Planetary Health for the very first time. And then some of you have been instrumental leaders in building what exists right now. So those of you who are the leaders, for sure, I hope you say something right now. And there's a lot of dead space. We can have some dead space. But I just wonder, like, just as a group here, like hearing about that, like, ooh, like what would be your dream for a center like that at Stanford? Like, name something that you'd love to see be part of that, or a way. It could be either a process by which we get to something like the actual organizational aspects, or just something real, like, or an impact, even an outcome of having a center here at Stanford. Like, what would be your dream for something like that here on campus? Yeah. Oh, yeah.
I would want to make sure to get our students out into the field, but create something where, yes, our students are out there, but we're bringing people from all these other communities to campus, that it's a convening place where people from all different segments can be equal and have a voice and contribute to imagining this future. Like, what does it look like if everybody has a voice at the table?
A collective process of
Sharing and visioning, creating that shared vision, right? Oh yeah, Sybil.
I think the community building that you all do around bringing all these authors together who do community-based research or are really engaging in this particular methodological approach is incredibly powerful. And I would love to see a really established health research space on campus where that community engaged planetary health work is normalized, and where students are invited into that space where that's sort of a dominant paradigm.
Amy.
I would love to see education for the public, because I think that a lot of times there's problems and it's hard to understand as a citizen what to do. So when there's like education, or, like I remember when I asked you, Des, the first time, like, why do you care about your line of work so much? Like, explain global health to me. What does that mean? And I can assume what it means, but I haven't been in academia for as many years as people who work and do research have. And so there's something amazing about like showing others what you've experienced by being a world traveler, by seeing kids, how they cook in other areas. What are they missing? What are the health crises that our kids don't have that they have? Like, how can I really see what other countries and people are experiencing and going through, and what their challenges are, so that I can get invested in solutions.
Engagement of the public in the solutions after education and outreach, and
Because the only place you can really fund like education for another child is through a church or the Center of Compassionate Living. And I bet every person in the Bay Area, well, a lot of people in the Bay Area, we want to pay $400 a year to fund an entire year of education for a student somewhere else. Things like that.
so yeah, she was just saying creating compassion and pathways and just sharing. It's like that whole thing about, you've heard this, like the invisible web that connects us all. It's like throwing, like throwing paint on the invisible web so that you can more deeply feel and see how you're connected to everyone.
Yeah, because I think
Then it makes you much more likely to act in a way that benefits all.
Yeah.
Other dreams of our Human Planetary Health Center? I mean, it's happening now. She's the director. She's listening. This is your chance. Yeah. Oh, lots. Yeah, bring it on. Yeah, Erica.
I want to bring together unlikely partners to really question unchecked assumptions or to think about some of these big structural challenges that that aren't going to be addressed through just, you know, the day-to-day, like day in, day out.
You want to name some of those for us?
Oh, like economic valuation, like how do we think about what something costs or how we value it formally in the economic system? How can we rethink that? Or legal things, like how do we decide what has rights? You know, do rights extend to natural entities like rivers or mountains, like, you know, different examples around the world where that's being disrupted.
Yeah.
But yeah, people who wouldn't necessarily be in a place to question those assumptions and they're just day to day. But if we brought together like those policymakers and economists and global health scholars and everyone to just like really brew on some of this stuff together and think about, you know, how do we think outside of the box? That'd be really cool.
Yeah, I was thinking, like, as you were saying, just to have an open space for anybody and everybody to speak. So maybe like once a month or once a quarter to have a space where anyone can sign up to present a talk or an idea, a project, research question, and have a space where everybody can listen and chime in and think about how we can different ways and creatively and see how that changes the status quo.
Open dialogue.
Yes.
Thinking about the process part of the question, like what are the structures in place that allow this process to open up to more people? Anna and I were having an interesting conversation earlier. Like my background is from an ecological, you know, basic science research background. And I think there's a lot of people that get into ecology or get into biology or get into computer science or other related fields because they care about the world and they want to do things. And they start by doing basic research and trying to answer fundamental questions. And then eventually that might lead you into a problem where it's more of a applied problem. And you might want to do partner engaged, like work. You might want to do something where you're trying to implement a solution or come up with a solution, but we can't all have all of those skills at once, you know, and to have a structure where people that are doing basic science can then be easily plugged in with potential partners on the ground, and there can be a dialogue between the partners and what are their, you know, what are the needs that are most pressing that scientists can work on, and how can scientific advances be implemented, you know, in an effective way and be scaled. You know, I think that's a lot. I think what often ends up happening is people get into a field, and as they get more advanced in that field, they build up these partnerships over time on their own, and everyone's kind of like reinventing this wheel over and over again. I see Desiree doing it. I see Anna doing it. Like, you know, building your own research center basically in a location where you've built all those partnerships yourself, and you're managing all of that, and you're trying to manage it with grants, and it's just really hard. And some really amazing people can do it, but it's really hard to do. And so
It's hard to sustain too.
yeah. And so I think creating structures where that infrastructure is there for researchers that have skills and interests to come into and plug into without having to build all that from the ground up and spend their entire career doing that.
Yeah, absolutely. And then also there's some protection there for people who are coming in and building new relationships, because they can kind of like rest on the trust and the relationship building of the people who've been there for a very long time. And so, yeah, it's really, it's very important. Centering trust, of course, and it takes a long time to develop trust. Yeah, please. Okay, so we've got Ezra and then Josefina, and then maybe online, hopefully people are saying things. Please write things in the chat, folks online. Yeah.
We have 22 folks online.
Okay.
But no messages yet.
Okay, no messages yet. Okay.
I'm a veterinarian. I'm working with zoonotic diseases that can transmit to humans from animals for a long time. So I would recommend as a veterinarian that one health aspect can one can aspect and approach can be, can think, I couldn't, sorry, I couldn't explain, but all the health issues can be interconnected each other. As you mentioned before, life, nature, animal, plants are in interconnection each other. So I think one health aspect may be helpful to understand the future of the zoonotic disease and also transmission of some important viral and bacterial diseases to different types of animals or humans and plants, maybe, yeah, to
So you're saying
understand
a One Health approach.
One Health approach.
For this Human Planetary Health Center.
Yes.
Yeah. Sabina.
I was just thinking about defining your metrics, you know, what's gonna be your outcome, your impact of success, and how you're gonna measure your success. And being in an academic environment, in an ivory tower, that's gonna be mostly publications and academic publications. So like breaking that, you know, into like other measurements of success, which include like the communications of evidence and data to people, and which has been like an issue, like in terms of health, and we've seen it, like the wrong message and the wrong timing of the message, or you know, just the words, you know, it's so complex, and so crafting and dedicating a part of your mission to really communication and beyond the academic, you know, we're really good at talking to each other and like, you know, preaching to the choir and like patting ourselves on the back, but like really going out into the community beyond the Bay Area starting, but also like globally. And I think you have a very big privilege at being at Stanford, but also it's kind of a curse because you are like in the ivory tower. So just come down ground.
And remembering the communication is two ways. It's not just
Exactly.
me telling you what
Yeah,
to go. It's the
exactly.
listening.
That's a lot of listening.
Listen.
Yeah. There's a great communications chapter on foundations in this book.
Yeah.
Ethel.
Yeah, I was just gonna say, and more integration of citizen science. And we were talking about educating the public, but also, and I know we use science to generate data and information, but recognizing that there is valuable information out there on like, and within like citizen science community members, indigenous communities, and actually like kind of like bringing that knowledge and validating it and like using that to educate ourselves as well. And then also being a center that actually practices what they preach. I feel like that also can tie into like creating trust within the community here, especially from the student perspective, for example. If there are institutions that are preaching about, oh, diversity, but when you actually see what's going on, it's not aligning with what they're preaching about, people can easily trust within that and kind of like lose the engagement within that center. And so to increase engagement as well, like being, you know, practicing what you preach and putting in place pipelines or opportunities to get feedback from the community regularly, so that you, whenever you're not practicing what you're preaching, and then you can like communicate that person tell you about it, you can change it, and that's that kind of like exchange that.
Oh yeah, Andresa.
I'm also thinking that it is important to have feedback on the community that is around us, but also from, I mean, it's a global health approach. So if you could build bridges with other countries, other areas of the world, and share, you know, knowledge and share tools and maybe share problems too, because, you know, a problem in another part of the world, it's a problem for the entire planet. So build bridges and with other global health centers, with other institutions that are interested in helping.
Others? Yeah, Gordon.
So I would love to see a really robust portfolio of courses and curriculum at the university that support students, especially in doing innovative work in the space, and that allow for a like an incubator or an accelerator that is oriented towards a collaborative environment that includes the field work and the outreach with partners. And so I created a lab along these lines 23 years ago at Stanford and sort of evolved over time. And last year, together with my wife, created a Sustainable Societies Lab. So, I think there's a lot of opportunity now, especially with the Door School, to be able to really get some excitement behind that. And you guys have provided a truly inspiring model for the types of partnerships and the general process and orientation that's really going to be important for how that lives and sustains the students and their work and collaboration across the globe. So thank you.
Some of you talk, especially in I'm thinking about how also within Stanford, but more broadly across higher education, you can transform incentive structures. How do you change the tenure and promotion structures? Because you have essentially we have all good people with good intentions that enter systems that drive harmful behavior often, right? Which can be colonial ways of doing science, extractive science, many ways of poor partnership. But it's not because of bad people or about shaming, but it's about also we are humans and we respond to the incentive structures that we're in. So how do you transform funding schemes, the funding pressures and priorities, and also the promotion and tenure here within, not just here, but more broadly in academia, so that scientists can move into equitable partnerships and be agents of change and do all of the beautiful things that you all talked about, which are often not recognized or valued in promotion and tenure. So people who want to do it are kind of in this uphill battle and doing it in their free time on the weekends and nights, which is not what you want. Also, you don't want your center and your community to be burned out and exhausted and stretched too thin. And usually it's women who do that more than men. So how do you change how we partner, how we work with each other to do this amazing work that needs to happen, this work of service that needs to happen in the world? Erin.
I didn't want to cut off your.
Oh, please.
Oh, no. I was gonna just agree with you and build on that, which is that, to your point earlier, that leadership matters. Like, different institutions have different tenure policies. Here at Stanford, the bar for tenure is like the main bar that really gets looked at is that they write out to all the top people in your field. They're viewed as the absolute leaders in the field, and they basically ask, like, what do you think of this person? How do they compare to others in the field? If those top people in the field have these values and they say, Anna has done this amazing job, she's built these amazing partnerships, this is the way she's running her lab in this totally different way that other people don't do, if the people at the top of the field value those things, that can also change the tenure process. So it's not, I think there's other ways to change the tenure process, but I think it's interesting to think that like the people who are in the positions of power and leadership also have a big say, and you change some of the who's in charge and what the way they're thinking about things. I think that can also contribute to, even in the now going on 10 years I've been at Stanford, I've seen more recognition in this promotion and tenure process for efforts related to diversity and equity and service, although still research is the #1 thing. So I think these things can be changed by people who have a vision that are sitting at the top.
And what's one of our tenants, Erin, was first, persistent hopefulness.
Yeah, we need to say that. It's gonna go dark here now.
Is that your response to my idea?
Yeah.
Sure, go ahead, keep being hopeful.
It's about working in
It is.
imperfect
And
systems.
to work within imperfect systems to drive change. Like, we're not all going to run away and become, recluses and hermits in the mountains. Like, we're here because we are embedded in the communities that we're in, academic or otherwise. So, one of our tenets is work within the imperfect systems to drive change while maintaining our humanity and sensitivity, not getting burned out, because this came up again and again. Also, the exhaustion that people live, as many of us being in places of service and working in different ways that are hard and, in the global health community. And what goes along with that is experiencing the joy and power of basic human connections that allow us to catalyze and sustain that work And we wrote, this is instrumental to the fulfillment and long-term commitment of individuals and teams. It's like, how do you also as a community here, or, take that at different scales, maintain the humanity and the joy and just this like, the joy of being together, which we saw this morning when we were together, right? That's what sustains us. That's like our true.
Yeah, brings us the energy to do the work. Exactly.
Okay, I have one comment
Oh,
from
please.
Julio DeLeo, who's
Oh,
also on
great.
our Human and Planetary Health leadership team. So he says, I'd like to see more interdisciplinary work, projects bringing together academic and non-academic experts, policymakers, and stakeholders. So that reflects a lot of the comments that we're hearing here. I would love to know from, if I can jump in, because I know you kind of wanted interactive, but I mean, I think about this, the academic incentive structure a lot and how to get the work off campus. But you two have been so successful in that. So can you tell us, like, what is the secret sauce? I mean, Anna, I think you left academia though, right? You did. Is that part of why you left? And Desiree, you're still here. So, but you're
And
so-
questioning. Yeah.
Good question. Where do you start?
Oh, no, you go. First.
I mean, what motivated me to do the work and what drove me were my friendship and my partnerships with the leaders who I was working with in the public health sector in Ecuador. Like I was talking this morning with some of the group, like these were people who I saw who were deeply committed to their communities, who were in the most, in the deepest way, civil servants, public servants, there to serve their communities in the public health sector. They were respected. They had been there for decades. And they saw the potential to work and to bring science into that, because I was working in an area that had very little to no science happening per se, or public health science. And so they just opened the doors and were like, yes, please, this like generosity and kindness to also welcome me who they didn't know. And, as at that point, as a graduate student, and to be able to learn from them. And I remember the first day that I'm thinking of one of my long-term friends and collaborators, Dr. Efrain Beltran, who's now retired, who headed the vector control unit for the province for many decades. And just being with him and seeing how, like the first day in the office, like the media shows up and they're there talking to him because he was trusted. And he felt he had an obligation to bring information and data to the community. Like they came to him. And I was like, so just being alongside people like that is what always was my like deep motivation. And seeing how they, and so just like listening and learning and accompanying them, I think drove me to want to continue the work. What pushed me out of academia in some ways was a misalignment with my values and the values of people who were around me at the university I was in at the time, who I think were more interested in profit-driven science and clinical trials, and had very little interest, I think, in actually the well-being of the communities we were in. So I just saw this like huge ethical misalignment, and I was just ready to move on.
By the way, that's not true in the human and planetary health community here at Stanford. It truly isn't. I mean, really, I think the values are so aligned for impact and community purpose.
I would say for me, I think what keeps me doing this hard work is the relationships, and it's actually the partnerships, and it's what she just said. It's actually like the joy and power of actually human connection. At the end of the day, I'm a little animal, I'm a human. And what brings me joy is actually, and inspiration is actually the partnerships, and actually what happens when you can build teams and groups of people that are aligned in a beautiful vision. And then you do it together. And so it's just like this cycle of giving and receiving, and it's like, and it is self-perpetuating, and it is fueling. I am blessed with having the most beautiful souls around me in my lab, in my collaborations. I always say, like, I go through life, I have a very charmed life because I feel like I'm a magnet for like human gems. It's just like a magnet. I have like a very, and now I've gotten old enough where like, when you aren't one, I say no to you. And that's also, it's really important for me, actually. So the joy, there's a lot of joy in the work and yeah, but more and more as I go on, like, just because my eyes are sort of wide open to this, it's just, it can be so frustrating, like the systems that we're working in and how just broken they are. And so it's very difficult when you can feel it and see it all the time, and then still to be a part of it. And you try as much as you can to break the cycles within it, but you do sometimes feel powerless to very big systems that need to be undone. And so, and that's the dream I have for our center, is like incredible disruption of the status quo.
And actually, that's the best part of my job now. So it was like the greatest thing that I've made this transition for me, because now I feel like I'm in a space where I can drive change in different ways, where I can influence global research funding priorities and processes and who's involved, and driving inclusive processes, training and supporting research teams, working directly with the governments and the scientific communities. So I have like the best job ever now. I still work with the science and the scientists, but now can create and support structures to build and allow, you know, or hopefully create spaces where others can thrive. So it's really fun.
And that's the thing I want to say, like, it takes all of us, right? Like, we can do so much in academia. There's so much that's done outside of academia. And I think just learning from the systems, doing whatever we can within our systems and across our systems to push the agenda forward, you know, the just agenda for the world, which is kind of what we're trying to do here again. So in our last few minutes, I'm going to bring you back to the book. And can you tell us a little bit the origin story of our book? And then for the authors that are in the room, Krish, Josefina, Sonia, Amy, and those online, anything that touched you in the process, because we're going to talk just a little bit about how like this sort of like transformed our lives. I actually really think we really do think this has been transformational for us personally and professionally. And so we'd love to hear from each of you if you would like to share like how it was for you being part of the book and what your dream is for the book. Like, do you have a dream for what will happen once it's released into the world and so forth? So the origin story, please.
So in 2019, I had a random email from an editor at Springer, which I almost deleted. I thought it was spam, you know, like as we get so much academic spam, right? And I had to like reread it a few times. And it was legit. And she just wanted to talk. She was like reaching out, I think, to lots of people in the field and just wanted to kind of get a sense of like what were trends in the field and to think about what kinds of books or products Springer should try to develop like in the next few years. So we had like a half-hour conversation and I didn't think anything of it. And then a year later, and this was exactly on March 2020, we actually went back and looked at the emails. I got another email from her and she's like, so we talked a year ago, do you remember me? And what do you think about writing a book about global health? Global health, not about like academic response manual, but more about the human pieces of it. Like, how do you do it? Really? I was kind of took me like, I was like, oh, you want me to write a book? I don't know how to do this. So then I talked to her and I'm like, no, this is real. Like, you can do whatever you want. You can write a book on anything. Yeah, we'll publish it. You know, like, that's pretty cool because then you can just really have like this blank slate. I can do whatever I want. And so then I pretty much immediately thought of Desiree and called her. We didn't even know each other that well then. Like, thanks to Erin, we had met. We had spent a few days in Ecuador. We had to work on the book together. And at this point, we're like just entering the pandemic. Like, I had just moved to a new country. I moved to Uruguay 3 months before. And I was 4 months pregnant. And I said, yes, I'll do this as long as it's a project that can be like a long burn. It's not something that we have to turn into book manuscript like in 6 months. And our editor was amazing. She's like, yes, of course, don't worry, you know, I'll work with you on this. Allison, if she's here, Allison, we love you.
Yeah, we love you.
Allison's amazing. So then Desiree and I spent almost a year just meeting and talking about our dreams and like really kind of putting it all on the table. Like, what does it mean? Like at a deep level of partnership and our experiences. And we put together the book proposal and we put it out and we're like, we're going to be as
Radical as possible.
Like, we're gonna write this exactly as we want. This is not academic at all. We didn't put any citations in there. We just like wrote it from the heart. Or this is what we want. This is our book. If they don't like it, too bad.
Yeah.
But then they liked it.
Yeah, and then we're like, oh.
Like, we gotta write this book now.
Yeah.
So we started then reaching out to like all of these people we knew who were doing what we thought were really deep, meaningful partnership work in different countries. We were very purposeful in terms of, we had a schematic of geographies, types of partnerships, obviously gender, and although at the end,
Oh
we
yeah,
think,
we're,
like, it's like almost a global health in women books.
No,
It's
it
not.
Well, that's
Most
is
of the
concern.
authors are women, which we invited many men also, but in the end, it's
Because
a lot of women.
so we
authors.
were very intentional about what we thought, and then we also asked for people like, what are we missing, right? Because we're two people, we could easily, with our own experience, we could easily miss what might be important for others. And so we had many different authors from all different stages, from students to been in the field for decades, in-country partners, government, local governments, US government, academics, teachers, practitioners. I mean, it's like the list goes on, like lots of different indigenous communicators. And so we just want, because we got scared, like, oh God, maybe we're missing something really important. But so together we crafted this book. And one of the things, so the middle part here, which, we've talked a little bit about future visions and we talked about foundations of it, but the case studies, we asked for case studies. But just as you said, Andresa, like we weren't asking for the A story, like we wanted the B story. We wanted like the gritty, hard, vulnerable,
Real.
achy, real B story, like the challenges. And so what we were faced with was that's a very vulnerable place. And in the systems that people work in, not everyone can tell their B story and still have a job the next day.
Yeah.
So there were many people who
Dropped
could
out.
not, they dropped out. We had people drop out because they couldn't tell their B story because they weren't able to and feel safe in their positions. We had people drop out because a lot of the people we were reaching out to, so it was during the COVID pandemic. We were front lines. I was front lines. I mean, I'm surprised any of us, right, who wrote the book. And then there was this one moment where Anna and I was like, because a lot of the people who ended up dropping out were men, in fact. And trust us, it's not all women. There are lots of men in our book, don't worry. But there was this moment where we like looked at each other and we're like, are we writing a book of the women, for the women, by the women? And luckily, no. But there was a moment there where we were like, wait.
But gender is an intentional theme in the book.
But gender isn't, gender is an intentional theme, but it did, yes. Anyway.
And we asked the authors to write the chapters, bringing in their eye to speak from a place of power of their own stories. So we didn't want a textbook, kind of like a uniform, edited, sort of a flat. We wanted the chapters to be different and to feel different and to have the texture, like feeling in the words authentically of the voice of the different people who were writing. But that's also why it was so moving. Because I was telling Desiree, like, we're the only ones who have read the whole book. Everybody else has like seen their chapter and maybe one or two others.
Yeah, because we connected the chapter writers and kind of paired them and cross-edited and had a community.
But we read all 26 chapters multiple times.
Yeah.
And so it's just an incredible.
It's an honor and a privilege. Yeah.
I think also, I feel like someone, like Krish, I just met you for the first time. I feel like I know you. Like I've connected you connect so deeply.
Believe that we haven't met
I
yet.
know, right? Because
Just speaking.
we're reading the text of other people over a period of years now, because the whole book took 4 years. It's about to come out. Like, it's just such a deeply personal experience. We're hearing and reading people's stories, and it's so beautiful. And like, so, and through that process then, like Des was saying, like, I know I was transformed.
Yeah.
Like to just hear the stories of the people around the world.
It's such a gift. It really is. And
so I think that like my ability to, for example, have moved into my current leadership position as the executive director of my organization was largely part of this process. Like being able to find my voice or to feel empowered and to feel supported by the stories of all these people, you know, transformed my life.
Yeah. And I would say that because we took the time and we went through this process, it's like I was telling her, and I had this like out of body experience because recently I've been part with many of you in the room of this big application to create like a center for climate health in Kenya. Who knows if we'll get the center, but what happened was when I was building that, there would be these times where like things would just like come out of me and I'd put it on the paper. And when that would happen, I would actually realize that like I was almost like acting out and living out what I learned from the book. And when that happened in my body and in myself, I knew I was like in complete alignment with who I was and what I wanted to see in the world, what I thought the vision should be. And so it was just this, I called her up, I'm like, oh my God, I just like, I'm living out our book. It's like, it's this thing. And so it really has, it's been like very transformative for us. And the thing is, we've read the whole thing and we lived through the whole thing. It's been like something we've done on the nights and the weekends, because that's how
On the plane.
on the
only time I
planes.
have time to read this
Yeah.
much and edit
Right.
is on the plane. And we have
Yeah.
full-time jobs.
But we did
and
it.
families.
Yes, we did.
And
And a
crazy
lot-
lives.
Crazy lives. But for you as authors, we just wanted to open up just for you to just say, if you have any words to say, I mean,
If
again,
we're
we've
not-
read all 27, maybe for you, you just sent in your
Again,
chapter, like,
whatever.
no problem. But I don't know if there was anything. Krish, go
Yes,
please.
You don't have too much time, so I'll try to be brief. I wish I had written this chapter now, but had I not been invited by you, so thank you so much, I wouldn't have been able to think about this. So I'm saying that in the wrong way. We can't predict the future, but we can see what the past became. I had no sense of what you needed from me, and it was very organic in terms of, you know, reshape like this, think like this, bring in these examples. And it's not really important to talk about where the book started. It's more important to explain what's happened since. And I'd completely forgotten that it's 4 years on. I actually gave a talk in November at University of Amsterdam in a conference and a workshop organized around decolonizing global health, specifically. In the University of Amsterdam, a room about this size, maybe a bit bigger, maybe a time and a half bigger than this, that in the 1990s had been converted into a commemoration of the Dutch East India Company. So you imagine just really the most colonial room you can imagine. And of course now that room doesn't sit well in the university where there's a much more diverse student body, much more diverse faculty who say, what the hell are you doing commemorating this stuff? So this was a specific series, and we had people from the local Tropical Health and Medicine Institute turn up at this talk and talk to me afterwards and say, and I really meant to connect them with you to say this book that I presented some work on was in line with exactly the struggles that they're facing, because there's a generation that believe the name should change and fundamental things should change along the lines of what you've described. And there's a generation above who Erin is probably alluding to, the great and the good, the leaders of the field from whom we have to draw letters who say, no, this marks something significant. And actually that your book, the chapter that you so kindly let me write for your book has changed the direction of my work, has just opened up an entire direction of work for me at the time that I actually was wrapping up the publication, some work that we were doing on predictive intelligence using AI, turned up results that made sense because of the research I'd done for the book. And I think it just drove me to think about applied decolonization in an entirely new way. So if we actually start to tease out, so some of the things that you're describing just have my mind rolling right now. If we actually start to tease out where things like toxic stress stem from in certain communities, we would start to look back in time. If we look at the, 500 million Kaiser had to pay because of not providing mental health service to Latino groups in this area. If we actually took account of the massive costs that colonialism has had on human health, that would be a really powerful way of reshaping the things that you're describing. And it's something that very tongue-in-cheek, I call David Attenborough syndrome. Great and the good, since 1954, who says himself, I had the privilege to travel around the world. And we'll talk about the impacts on environments of palm oil production, of how that damages the planet and how that damages orangutan populations, and stops at saying the people who own the land during the period of colonialism still own the land and still make the decisions about what you plant here, irrespective of the damage it's doing to the environment and the people around those environments, and unless we're willing to change that. So I'm really impressed by the things that you've described to us today. I'm extremely grateful to have a chance to write the book, and it's opened up a whole branch of thinking for me that I hope will concretize into a center that we will connect at some point. Thank you.
Thank you.
Okay, I can say something. So when I was invited to write the book, to write a chapter for the book, I was supposed to be part of the foundations and kind of bring my own perspective. I'm from Ecuador originally. I came to the US. I studied, I went to college there, but I came for a summer internship to the US and I never left. I ended up went to grad school and et cetera, et cetera. But during that year, I was sick, so I couldn't really put all my brain cells. And also I started to feel very uncomfortable because I felt that still I was talking with the voice of someone who had privilege, because I came here, I had done well in academia and done my research, but and I have a lot of partners locally, and especially one person who has been kind of my moral and ethical reference since the day I met him. It's like Dr. Beltran for you, Harold was always like a community member who has an amazing story, and I thought that he was gonna be part of my story written from my voice, but I said no, this is his story. We should twist it around and have him tell the story of how he became a scientist after having been a kid selling chewing gum in the streets, and he's now an epidemiologist, how that happened. So he tells the story from his voice, and it just came such a beauty. I would have never been able to do that. It would have been always kind of my perspective from a different vision. And I'm so glad that that happened, because now it's a really, really beautiful story from his perspective, which, it's much more valuable. So I'm glad that I was part of it, but I'm not the author of the chapter. Harold is, and so I think that's an important thing. So I'm so glad that I'm part of this, and I'm so excited to read the book, because I think that we're all gonna then kind of channel all these stories into our work, and to be able to do our research or do whatever it is that we're doing with a new lens, new perspective, more rich and changed. Because even this one chapter changed me, we cried so many hours. every page was like hours of crying with Carol.
I know, both of us. Josefina calling me and be like, all we do, we just get together and we get a little bit done, but really we just cry. And I told her, I was like, yes, that's what we wanted.
They're doing it.
Yeah, they're doing hard work. Yeah, oh my God.
And Josefina, yesterday, Erin asked me about the case studies, and I said Harold's chapter was my favorite. Not that they're all beautiful, but I connected so closely because I translated it.
Yeah. Oh, yeah. And you probably saw you've seen kids like that, right, in your life in Ecuador and stuff. Yeah.
Such a beautiful chapter.
He's from Nicaragua. His part is his story from Nicaragua.
And the cool thing about the book too is our publishers were just so cool, right? Because a first person really autobiography is not like your typical case study. So we could just do whatever we could, and we put it in there anyway, and we figured out ways to put everyone's thing in, and it's just so beautiful. Yeah. Anyway.
We are at time and the reception is set up, but I think there's a lot of conversation that can continue. Can you both say your final parting words of wisdom, what you want us to all leave hearing about partnerships for climate and health?
Well, we have two other authors here in this room, and I would like to just give them a very brief 30 seconds in case they had something that they wanted to share, because I think it's important to have this.
Yeah, I'll be brief. When the idea of the chapter and the book came to me, I was not looking to write anything, because I was more, my eyes were on retirement rather than. So it took some convincing from Desiree. But later on, when I started the process and then finally got to realize how many people, other authors were part of this, it was like an offer that I couldn't refuse because it was like an amazing feeling of being in the presence of people that are thinking alike. And I had a history of social psychology and community work in Puerto Rico. All the values were so attuned with what the book wanted to accomplish. So and then I had years of experience with the LaBeaud lab and with Desiree in building a team here at Stanford and building collaborations in other parts of the world. So the team science part and our experience is not a case study, but in the chapter that I co-wrote with Maritza Salazar Campos and Desiree, there's a parallel between the science and what we were trying to do. Not trying, we were accomplishing by putting a lot of time and effort into it. So that's what the chapter is about, is telling the story of what are the things that are important when you are doing team science and working together and building collaborations from the perspective of an experience, not like this is what you need to do or follow our example, but this is what happened when we did it. So that was an amazing experience for me, and I thank Desiree for convincing me. You can do it. You can do it. So, thank you.
Yeah, I think I'm the odd duck because I'm not a scientist. I'll say I'm a soul scientist. My field is transpersonal psychology, and transpersonal, some people call it spiritual psychology, but it just means beyond the ego. So your human potential, you could think of it as. And I also do healing work. I have a private practice here in the Bay Area. And so Des and I had just been to see the Ruiz brothers. Their father wrote the book, The Four Agreements. And I'm gonna try and remember our exact conversation, but I remember I had led an art project in downtown San Mateo during the pandemic that was like a healing public art installation where people could write kind of what they lost, what they were grateful for, all the things they were going through. And it was just a huge box that was like a chalkboard almost. And it was inspired by an artist named Candy Chang who did the Before I Die, ... Well, before I die, I want to do XYZ. And I had so many people coming up to me at the time, just like random people on the street saying, wow, I can't believe you asked me this question because no one's asked me anything. No one's asked me anything about, like I've lost my uncle, my brother. One guy wrote he lost both of his parents due to COVID. And one 60-year-old man was just crying with me, a total stranger, just crying with me. And after Des and I went to this retreat hearing the Ruiz brothers, one of the speakers was also so, I was just constantly being moved by other people's stories. And the theme around all of it at the time was, gosh, like everyone is going through everything. Bottom line, everyone's going through everything. And if we could all just like talk about that, because what everyone was saying at the time was, I'm going to work and like no one's asking me how I'm doing. And I'm showing up in my life and I have like what's actually going on, but then I have like the research I'm doing and the projects I'm doing and the funding I'm trying to get. And so we had this moment in the car and I remember you just looked at me and she was like, oh, we should put this in the book. And I was like, I'm not a scientist. And she's like, no, and had this vision and called Anna. And I was like, oh, what? And so what we ended up writing about was truly, the kind of old phrase of bringing your whole self to what you're doing, but in a deeply authentic way, because how can you really show up and build partnerships if you don't know what's going on inside? So there's like yourself as you're showing up, but then there's the capital S self of, are you really kind of being raw with your biases and what you've been through and your judgments, kind of the good, bad, the ugly, and the dreams too, sharing your dreams. So it was a beautiful process. And I had a secret fear for a while, like, am I gonna be criticized because it's so out there? It's so weird for a, it's not technical. It's very introspective. But it's also like, to me, the best thing on earth and the most important thing is like who we are and how we're showing up. So
It's the last chapter. So
Yeah.
we start with colonialism and we end with bringing your whole self
yeah,
to your,
and I can't wait to read all the other chapters. I've
Mhm.
only read one, I think, or two.
the bread on a very good sandwich.
Yeah.
Your chapter on that one.
So thank you for the transformative journey. It's so nice to meet you finally.
I mean, we are late and I don't have much to say other than thank you guys for being here and
Share the book with everybody.
yeah. It's free and it'll be
free.
online.
And
Just give it
this
to
was the
everyone.
other piece
Oh,
to
we had an
puzzle.
idea
We didn't-
too.
Yeah, well, we did
Yeah, we do
mention
have an idea.
that thanks to the generous authors, some of here in the room, we
Yeah.
fundraised the
Yes.
more than $20,000 needed to publish it completely
access.
open access.
Yeah.
So it'll be
completely
available to
free.
anyone in the world.
Uh-huh.
And we are
And-
now scheming about how we can translate the book.
I told her last night, I'm like, oh my God, because there's all these amazing translators with AI now. And I was like, it's gonna be online anyway. We have the PDF of the whole book. We could just translate it into 70 languages. I'm like, then we can be one of those people that goes around saying, my book was translated into 70 languages. Because we did it ourselves. But we wrote to Springer because there's probably laws.
Allison,
But
if you're
Allison,
listening,
if you're listening, let
we'll
us know.
translate.
But anyway, yeah, so just
Please
read it, share it, let it move you, be moved. And yeah, we hope that it helps to transform this world into a more equitable, loving, peaceful, healthy planet and people. That was our hope.
I'm gonna print it and give it as gifts, because I think that this one of those things that we should have them like printed, next to your bedside.
Well, you can, you could actually officially buy a real book.
So there's gonna be also
Every author
yeah.
will, every one
You will
author
probably get-
chapter. The
Yeah,
lead
I don't
author,
know,
so you or
something.
Harold, so Harold will
Yeah.
get a copy.
Yeah,
but
yeah.
Then you can buy. a
And you
print
can
copy.
buy, like Springer would love to sell
Yeah.
anybody in the world a book. So like, I'm sure you'll be able to buy the book in a book form, but.
And you can use it for all the freshmen who come to planetary. Health.
Yeah.
And it is part of the Sustainable Development Goal Series.
It's part of their special sustainable development series
Yeah.
at Springer.
Yeah, so, yeah, we talked about the SDGs and everything. So thank you guys.